You heard Tram mention just a minute ago, just about all of us have a personal story connected to breast cancer, a family member, a neighbor, a friend, and these numbers may explain why. Statistics from breastcancer.org show this: about 1 in 8 women here in the U.S. will develop invasive breast cancer in her lifetime. Back in 2009, the CDC says more than 211,000 women in the U.S. were diagnosed with the disease. More than 40,000 died from it.
Joining me now is Leanne Maddie, who tested positive for the gene BRCA1 a year and a half ago, then had a double mastectomy. Leanne, take me back to that year and a half ago when you first tested positive. What was that like?
You know, it was a challenge. Before I had found out that I had it, I was living a normal life and just moving on with my children. And my mom was tested and brought that information to me that I had a 50% chance of getting that gene or having that gene. And I did test positive, and you know, I made some choices.
And why did you choose to get that double mastectomy?
You know, I looked at it as a gift of knowledge. I knew that I had children to live for, and I was not going to take that lightly. I felt like God gave me that gift, and I was going to use it to prevent my future from being devastating.
But were you scared emotionally and
Absolutely.
just physically?
Absolutely.
What was that like?
It was a hard decision. I was full of anxiety and concerned, but I was not going to ignore it. I knew that if I had this, I had to act upon it. So
let's talk about your mom, who, as you just mentioned, tested positive first. And again, this was about a year and a half ago, and we're looking at pictures of your beautiful mom. She decided to wait and instead be there for you when you went through this double mastectomy.
Right.
Tomorrow morning, she undergoes her double mastectomy.
Right.
How is she handling all this?
She's doing very well. She knew that if I could go through it, she could do it too. And you have to support each other and your family. So.
Okay. Right now, I want to bring in Dr. Mike Janicek, gynecological oncologist from Arizona Oncology and medical director of the genetics program at Scottsdale Healthcare Virginia G. Piper Center. Explain, first of all, what these genes BRCA1 and BRCA2 are.
We all have them, men and women. They're tumor suppressors. They prevent cancers. And if you have a bad copy of the gene, it's like having a car with a bad set of brakes. So it predisposes to getting cancer. So in a nutshell, that's what they are. They are good genes, but if a mutation is present, they can turn bad and help lead to cancer.
And it's the same gene and also ovarian cancer, which is not getting a lot of attention in this.
Exactly. In the introduction, Miss Jolie's mother died of ovarian cancer, but focus has been on the breast. The BRCA is a misnomer. It should be called BRAV, breast ovarian. There's a 40 to 50% chance of getting ovarian cancer, and of course the 80 to 87% chance of the breast. But the ovarian cancer is the silent killer. There's no screening for it. It's actually the more dangerous and the more deadlier of the cancers. So thank you for bringing that up, because that's, as a GYN oncologist, there's not a day that I'm not dealing with women that have had this tragedy with ovarian cancer, and it's a very, very difficult one to pay attention to.
We talked about how Leanne tested positive, her mother tested positive, her cousin tested positive. Is this hereditary?
Absolutely. If there's a mutation in the family, there's a 50-50 chance, as you mentioned, to get passed on from generation. Also, men can get it, and they can pass it on to women.
But it could also skip a generation, too.
No, it cannot skip a generation.
Okay.
The gene, if your mother tests negative and she had the cancer, it stops there. You're not going to get it unless you got it from the father's side. Okay. So you always have to pay attention to both sides of the family. Gilda Radner's mother died of breast, but Gilda Radner died of ovarian. So they got the cancer from the father's side, the grandfather's side of the family. So you always have to look at both sides of the family. Because we talk about breast so much, we always think, oh, it's a female-related cancer. And I've actually had ovarian cancer patients that were told by their practitioners, don't worry about it, it wasn't on your mother's side of the family, and that's absolutely wrong. You've got, you know, Miss Jolie's mother died of ovarian cancer, but she could have gotten this mutation from her father just as well.
So who should be tested?
Anyone with a family history of cancer. And I know the guidelines, and they're 2 pages long. The bottom line is, if you've got this family history where you're looking around the Thanksgiving table and you're saying, we've got bad luck in our family, ask a professional. We don't have to go through all the guidelines. Basically, if you have multiple family members, especially with early onset breast cancer, antennas should go up. Start asking questions.
But what if you don't want to do a mastectomy and you test positive for the BRCA genes?
Well, there is an option to focus on the ovaries. If you remove the ovaries preventatively with the BRCA mutation, you cut your risk of breast cancer in half, which is actually an understated fact. And many patients, Ms. Jolie decided to go with the breast cancer surgery first, but she could have chosen to remove the ovaries first, actually protect the breasts, and decide later whether she wants to prevent the breast cancer or not. So there are both options. You can have one or both. as a choice.
This test involves blood work. Why is it that it is so expensive and it costs thousands? In Angelina's case, she paid $3,000. Why is it so expensive?
Because it's worth it. And also the technology is expensive, and most insurance companies now pay for it. Medicare pays for every one of my ovarian cancer patients that want the test. If you meet the criteria, most insurance companies want you to test. They don't want to pay for your surgery and chemotherapy and radiation. They actually want you not to get cancer. They'd rather pay the $3,000. So it's expensive because it's worth it, and it's paid for by most insurance. And with the Affordable Care Act now, women now actually are empowered to get the test. Even if they're not affected, they have the right to ask for the test now.
And Leanne, I know in your case you paid $500 because luckily your insurance covered that. I want to thank you so much, and to you too, Dr. Janicek, for clearing everything up and just giving us some really, really valuable information. And we wish your mother all the very best. We're thinking about her tomorrow.
Thank you.
Thank you.
Well, we also want to remind you early detection can be key to diagnosing and beating breast cancer. So head to buddycheck.azcentral.com to sign up for our free program. On the 12th of each month, Lindsay Cooney will send you an email or leave a quick voicemail to remind you to do your breast self-assessment.